Welcome to Not Stopping for Directions, a podcast for and about dads, especially those parenting children with behavioral health challenges. I'm your host, Michael Carmen, and this podcast is brought to you by the Kentucky Partnership for Families and Children. The content included should not take the place of clinical or medical advice and are purely points of discussion for you to consider during your parenting journey. Welcome to Not Stopping for Directions. This is episode number 9, and today we are speaking with Dr. Alan Brenzel. Welcome, Dr. Brenzel.
Thank you.
And good to see you. If you don't mind, tell us a little bit about yourself, who you are, and what you do.
So, yes, great to be here today. And as mentioned, I'm Alan Brenzel, and professionally, I am the medical director for the State Department of Behavioral Health, Developmental, and Intellectual Disabilities, the state agency that helps oversee the public mental health safety net. Also a professor of psychiatry and pediatrics at the University of Kentucky. But also, in my mind, most importantly, the father of 5 children in an interesting family. Had 2 sets of twins in a row. So I have identical twins followed by fraternal twins, and then have what we call our singletons. So father of 5, an expert at work, but a father at home.
Gotcha. All right. Well, and we're always learning in that fatherhood path as well. Children are great teachers.
Indeed.
All right. Well, we kind of talked beforehand and agreed that maybe we would tackle the issue of childhood trauma. It is actually Children's Mental Health Acceptance Month. Used to be called Awareness Month, and as we grow and improve on these things, or hopefully grow and improve, we learn new ways of talking about things, and acceptance is kind of where we landed on this. There are certainly many things that can impact mental health, and we hear a lot about trauma. So if you could, what is childhood trauma, and how can traumatic events impact mental health generally for children?
So, yes, trauma is a word I think that in some ways is a little bit challenging to define, particularly when we speak about younger children. But sort of the professional definition of trauma is something that someone experiences that's outside of the realm of normal experiences that creates fear or anxiety. And so you can see that's relatively broad. In adults, that might be a military example where someone experiences exposure to violence during a military service and develops post-traumatic stress syndrome. But in children, trauma takes many forms. I do a lot of work here in my professional capacity around children who may have come into the awareness of the child welfare system. So some of them may have had actual physical abuse, maybe sexual abuse, maybe even emotional abuse. But trauma can also be things like being in a motor vehicle accidents, experiencing gun violence. And what's really interesting is a lot of my early work was around attachment and the presence of and importance of having a stable and solitary or a consistent attachment figure. And in my mind, the lack of that is also traumatic for children.
Sure. Yeah.
So there's a little bit of a blurring between, loss and perhaps the lack of attachment figure as a traumatic experience for children. And then maybe as they get older, maybe specific, more environmental kinds of trauma.
So how, and I'm sure there's a vast kind of range of behaviors that might be displayed following a traumatic event. Could you give some examples of what that might look like in children?
Sure. So, let's talk about a little bit older children first, in a sense that they, have the capacity to understand something through verbally and have a language to express that. But if a child experienced a traumatic event, one of the things we might see is reenactment of that trauma in their play. And so that would be a sign that maybe they're trying to master that, but that kind of trauma is in their play. For example, a child who's in a motor vehicle accident who might have had a some kind of injury or their
Mm.
caregiver injured, they might in their play be reenacting the car accident, sitting, in a chair and then falling forward, or reenacting it with their play figures. That doesn't necessarily alarming, because that may be a normal way to
Sure,
process trauma, right?
it seems
Play
like
is
a
the work of,
healthy, right, a healthy way of coping and learning.
but concerning things would be, and the definition of post-traumatic stress is that a person experiences intrusive recollections or memory of the event that create a sense of fear and or of reliving the accident or the incident or the exposure. So those we sometimes call flashbacks, right? So
Mhm.
if a person has flashbacks of the people who develop PTSD often develop a general sense of hypervigilance.
Right.
They feel hyper aroused and anxious. They're on guard. They have an easy startle reflex. They may appear to be, uncomfortable scanning the environment, looking for any possibilities of harm. And so we
Mm.
call that hyper arousal or hypervigilance. Those are other symptoms that might develop in someone's. And then being triggered by reminders of the event.
Right.
That's sometimes part of what we as caregivers have to sort of try to understand. If we see a behavior in a child who's experienced a trauma, is that behavior possibly related to a trigger? And those can be subtle sometimes, like if another example, if a red pickup truck was associated with the trauma, when they see a red pickup truck, they may relive the experience. Sometimes it's as subtle as a certain smell or a certain temperature or a certain song that might have occurred during the abuse or trauma. And so being subjected to triggers that cause this re-experiencing is one of the symptoms that you would want to be concerned about.
Gotcha. So I'm in Louisville, Kentucky, and a few weeks back we had a mass shooting event. It occurred at a place of employment, and it was an employee. So of course that was in the news cycle, unfortunately for a brief amount of time, because these things happen so frequently. But one of the folks interviewed was Representative Morgan McGarvey, and he, in the context of being interviewed, mentioned that he relayed that there had been a shooting event in Louisville to one of his children. And his child's immediate response was, "Oh no, what school did that happen in?" So all that to say, children nowadays kind of have this looming, perhaps, fear of something like that coming to visit them in what's supposed to be a safe place, school, right? Is that trauma? Nothing's happened specifically to the child, but they're kind of living with this reality and awareness or sense of danger. Would you call that trauma, or is that something else altogether?
I mean, I think witnessing a traumatic event like that and then applying it to their own life and then applying it to circumstances that might affect them can be a form of trauma, right? We know that kids who live in violent neighborhoods experience sort of repeated exposure. And then, especially if it's associated with loss, like somehow one of their family members is affected. But I think what you're describing is an unfortunate situation where, do I feel safe in my surroundings? Do I feel safe in my society? Do I feel safe when I'm away from my families? Because obviously what we want to do is protect our children and keep them safe. And that's when children do best, is when they feel safe.
Right.
Because it can interfere with their ability to learn, to be able to pay attention at school, to be able to interact with friends, leave the house. And this kind of exposure to community events, I think, can be associated to some degree with just generalized anxiety and fear, and leave kids susceptible to panic attacks, and which are just a little bit different than a specific trauma and reaction, but more about feeling safe. And anyone who's had previous trauma, they're very susceptible to these kinds of threats. So I really worry about the kids who've maybe had previous trauma, who are in situations where maybe they've been unsafe before and they see this level of exposure. It could certainly exacerbate And we do know somebody who's had a previous trauma is much more susceptible to develop post-traumatic stress with subsequent traumas.
So that kind of falls, or correct me if I'm wrong, the concept of ACEs, the adverse childhood effects. The more you kind of accumulate those, the more the next thing might be a bigger issue for you because your resiliency has perhaps been compromised.
That's right. And ACEs are an important thing for all of us to talk about. Those are a series of adverse childhood experiences that we know are associated with risk for challenges in adult and later functioning in terms of healthy interpersonal reactions, but even a variety of health conditions like smoking risk, obesity, hypertension, heart disease. And so we have scales where we try to measure things like if a parent's incarcerated, which is a loss, right? Exposure to violence, other events that are considered adverse. We have lots of evidence now that the cumulative effects of those leave kids at risk. Now, the good news is we're learning more about positive childhood experiences, things that can ameliorate, decrease the risk associated with these exposures, because sometimes it feels discouraging to just hear about, oh, we learned about these ACEs. Well, what does that mean?
Right.
Well, what we want to do is we want to prevent the long-term consequences of those through building in strengths and resiliency experiences, consistent caregiving. One of the things, for your listeners to be aware of is having one caregiver in your life, a person who thinks you're special, who takes the time to be attuned to you and to provide you with a sense of safety. That person, whoever it is, a coach, a teacher, a bus driver, that person can ameliorate a significant amount of risk associated with those adverse childhood experiences.
Well, that really leads into my next question. So a caring adult, be it a teacher, a parent, a caregiver, a grandparent, what have you, what are some tools or behaviors they can exhibit to kind of ease some of that? If a child, if it's a teacher, there may be something that triggers a child and you're not even aware, you don't see the evidence of what happened. You just see the resulting behavior. But what are some things caregivers can do, A, to manage that behavior, and B, I guess, to create situations where that's less likely to even happen?
I mean, it's a little challenging to say broadly because it may be very specific in a child who's had a previous trauma. But I think part of it is recognizing that there is a lot of trauma out there, recognizing that a behavior that you see that looks just like defiance or aimed at you, that trying to understand the possibility that behavior is in relation to a previous experience or a previous trauma, taking the time to not react in a way that would potentially worsen that. Because I know as a parent, one of the things that's is to be consistent, to be calm, to be structured, to offer the child an opportunity to have strong emotions without letting those impact us and us reacting back in an angry way. So I guess what I'm trying to say is that in traumatized children, the number one intervention is they need to feel safe. Right. So we need to create environments in which they feel safe. They feel safe to express their emotions. They feel safe that you will keep them safe, that if they're out of control, that you will manage and keep them in control. And sometimes that's the trick is that you need to control that situation, keep them and others safe, and do it in a way, that lets them know that there are limits. Right. And so I really think, the key intervention is getting to know kids, understanding their own experiences, being able to, if you can, identify triggers, avoid those if you can. If not, make sure the child, is in a situation where you can, because for kids, they want adults to keep them safe, and their anxiety will sometimes mirror your own anxiety.
Sure.
So if we can keep our own anxieties under control and say, I'm the adult, I am here for you, I will keep you safe, you don't have to worry, we will get through this. Now, if you have anxiety of your own, you need to go take care of that, right? And maybe talk to your partner, a caregiver, a friend, a confidant about, hey, I'm feeling. But around kids, it's really, they're very much perceive our own levels of anxiety. And so confidently intervening, being accepting, feeling not out of control yourself, and being able to avoid triggers and recognize their need to feel safe, I think are really
Right.
important.
That's interesting to think about, again, harkening back to this mass shooting event that occurred earlier, just a handful of weeks back. And you mentioned the adults managing their own anxiety. And I think that's becoming a taller order. There are real reasons out there to have concern and to question, our safe spaces no longer can guarantee safety, right? So that's it's interesting that you bring that
I
up.
think that's very true, because if you don't feel safe sending your child to school, it's going to be very difficult to
Right,
convince your child that it's safe to go to school, right?
right,
And yet where kids need to be is school. And so
right,
I think that is very hard when there's some evidence that, kids maybe aren't as safe.
right.
And as parents, you have to make those decisions as to what risk are you willing to take. And I think it's causing our families to make just different decisions sometimes about what they
Right.
feel safe with.
No question, no question. Well, just kind of as a final wrap-up question, what are some resources in Kentucky that you would point a parent or caregiver towards to help a child better cope with trauma that's occurred?
Well, I think just being able to recognize the signs and symptoms when it's, becomes beyond normal, and then seeking out counsel, and that can take many, many forms. I think very often in kids, their pediatricians, our primary care doctors, nurse practitioners are a place to start the conversation. If you have a concern, there are obviously some mental health centers and clinics. The state operates what are called the community mental health centers.
Hmm.
Those are available in each of the regions. And if you have really a situation where you're really concerned, 988 is one of the places that I would suggest that is now available. It's a number that you can call. It doesn't have to be an absolute emergency. If you have a question and need, want help getting a referral, it's for adults and kids. It's for mental health as well as other needs like substance use. And I would encourage you to use local crisis lines. Other possibilities are your schools systems. I think very often schools are very attuned to these
Sure.
days. And then, we really like this. It's called SAMHSA, the Substance Abuse
Hmm.
and Mental Health Services Administration. That's a reliable online resource that will be able to guide you and talk to you and give you information about specific signs and symptoms. And so I would look for the SAMHSA website if I were looking for just to read a little bit about some of these things.
Excellent. Well, Dr. Brenzel, I really appreciate you taking time today, and that's great information that you provided. It's a topic I think we are going to be forced to keep talking about and thinking about. But I am glad and grateful there are resources in our communities to kind of help guide caregivers and parents through the process. The help is needed, and I'm glad we can kind of reach out and get some of that.
And I think we need to support each other, because I mentioned, I have multiple degrees, but I think with my kids, it's really important to have a peer group of other parents that you can bounce these things off of, and ask, what's your child experiencing? What have you found works? It's raising kids, requires support. So I'm glad that
Absolutely.
you're offering this resource to folks.
Thank you, Doctor.